You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
This episode contains evidence-based information that's current as of the day recorded and may change as more data becomes available. To get the very latest information about this topic or other topics in pregnancy and breastfeeding, please contact a mother-to-baby specialist at 866-626-6847, by text at 855-999-3525, or through our website at MotherToBaby.org. Welcome to another episode of the Mother to Baby podcast. My name is Chris Stallman, and I'm a genetic counselor, a mom of four, and a teratogen information specialist. So what that means is that I talk to people about exposures that can happen before pregnancy, during pregnancy, while breastfeeding, and in cases of adoption. And an exposure can be anything. So it could be a medication that you're taking, or a beauty product that you want to use, or a vaccine that you get. It could also be substances such as alcohol. On today's episode, we're going to continue our conversation about FASDs, so fetal alcohol spectrum disorders. As you may remember, those are a group of conditions that can occur in a person who was exposed to alcohol before birth. As Dr. Jones mentioned during part 1 of this series, the term FASD in and of itself is not a diagnosis. Rather, it captures multiple diagnoses, including fetal alcohol syndrome. People with FASDs can have a wide range of health effects, including problems with behavior and learning, as well as physical problems, all of which often require lifelong support and treatment. We're hoping that by the end of this episode, you will be able to answer the question about how researchers at the CDC work to measure the rates of alcohol and other substance use during pregnancy. To continue the conversation today, we have 2 guest experts from the Centers for Disease Control and Prevention, also called the CDC. Nicholas Deputy, PhD, is a health scientist, and Elizabeth Deng, MPH, is a behavioral science in the Division of Birth Defects and Infant Disorders, National Center on Birth Defects and Developmental Disabilities. Nicholas and Elizabeth, welcome to the show, and thank you for being here.
Thank you, Chris.
Hey.
Elizabeth, can we start with you? I'd like for our audience to learn more about the National Center on Birth Defects and Developmental Disabilities.
Sure. Thanks, Chris. So within CDC, we have multiple what we call individual centers, institutes, and offices, and the National Center on Birth Defects and Developmental Disabilities, also known as NCBDDD, is one of those units. Our center strives to advance the health and well-being of our nation's most vulnerable populations, and we specifically work to study and address the causes of birth defects and support families affected by them, help children reach their potential by understanding developmental disabilities, protect people by reducing complications of blood disorders and genetic conditions, and improve the health of people living with disabilities. And then related more specifically to this topic that we'll be talking about today, CDC has been working to address alcohol use during pregnancy and fetal alcohol spectrum disorders for over 30 years now. And our work touches on several of the thematic areas that I just mentioned. For example, we conduct public health surveillance of alcohol and other substance use during pregnancy and surveillance of children with FASDs. We also support activities that aim to reduce alcohol consumption during pregnancy, improve identification of children with FASDs, and also to connect children and families affected by FASDs with services and resources.
Thank you. Nick, Elizabeth mentioned public health surveillance. Can you tell us a little bit more about what that is?
Sure. So public health surveillance is the ongoing systematic collection, analysis, interpretation, and use of data to support public health prevention and other activities. It's basically collecting data or information from different sources and analyzing it to learn about the steps that people, families, and communities can take to stay safe and healthy. Public health surveillance is really the foundation of public health practice. So these types of data help us understand how often behaviors are occurring in a population or how common a condition is in a population, like FASDs. And by having this understanding, we can inform prevention activities, service needs, and other types of work. And here at CDC, we're focused on making sure that public health data is accessible, flexible, equitable, and usable for action.
Great. How does the NCBDDD work to measure the rates of alcohol and other substance use during pregnancy?
So when it comes to alcohol and substance use during pregnancy, we have a few different ways of measuring that. One way is by analyzing data from existing public health surveys, like the Behavioral Risk Factor Surveillance System, also known as the BRFSS. So this survey collects a variety of health-related information from representative samples of the general population in each state. And although BRFSS is a general population survey, we can use those data to examine just pregnant people and their reported alcohol use during pregnancy by combining data from multiple years. And when we combine multiple years of data, that allows us to have enough information to produce precise estimates. So for example, we published a report a couple of years ago that examined alcohol consumption and binge drinking during pregnancy during 2018 through 2020. And in that report, we found that 13.5% of pregnant adults in the United States reported current drinking, and 5.2% reported binge drinking in the past 30 days.
Are there other ways for you to look specifically at people who are pregnant to measure rates of alcohol and other substance use during pregnancy?
Yeah, so we've been working with our partners within CDC's Division of Reproductive Health to modify alcohol-related questions included on the Pregnancy Risk Assessment Monitoring System, or PRAMS. So PRAMS is a public health surveillance project that focuses on behaviors, experiences, and conditions that happen before, during, and after pregnancy. So this project is one that's specific to that pregnant population. And we've been working with the PRAMS team to modify the way that alcohol-related questions are asked on PRAMS, so we can get more insight about the timing of alcohol use during pregnancy. And these modifications will also let us examine alcohol use in relation to other pregnancy-specific experiences and outcomes, which we're not able to do on some of those general population surveys like the BRFSS that I just mentioned. Another important tool that's specific to pregnancy is a project called MATLINK, the Maternal and Infant Clinical Network. MATLINK is a public health surveillance approach that works with clinical sites to collect de-identified information on pregnant person, infant, and child health outcomes following certain exposures during pregnancy, including substance use. And what makes MATLINK unique is that it collects information about the pregnant person and connects it to information about the infant, which other projects are usually not able to do. It's also able to assess outcomes for the pregnant person that happen up to 1 year after giving birth, and is able to assess outcomes for infants and children up through age 6. And we know that those are really important timeframes for understanding the different health impacts related to alcohol and other substance use during pregnancy.
Mm-hmm. What type of work does NCBDDD do specifically related to children with FASDs in terms of public health surveillance?
So we have a few different activities that focus on public health surveillance of children with FASDs. Because getting an FASD diagnosis is so important for being connected to services, we've recently been working to better understand how many children have an FASD diagnosis. As Dr. Chambers mentioned in part 1 of the series, underdiagnosis of FASDs is a major issue. Mm-hmm. And we know that looking at just those with an FASD diagnosis will underestimate that total population of children who truly have an FASD, which is estimated to range from about 1% to 5% of school-age children. But by looking at that population with an FASD diagnosis, we can get a better sense of their service needs, and we can get a sense of how much work needs to be done in order to improve identification and diagnosis of FASDs more generally. I'll also mention a couple examples of our work in this area, which includes a project where we review data from healthcare claims databases. These are data sets that are created for insurance purposes when a person receives health care. And as you can imagine, those types of databases have a breadth of information. But for this project, we were interested in information about diagnoses and types of care that children with FASDs have received. So far, we've analyzed those data to understand how many children covered by commercial insurance and how many children covered by public insurance have an FASD-related diagnosis code. And from that project, we found that during 2015 to 2021, out of every 10,000 commercially insured children, only 1.2 had an FASD code documented. And out of every 10,000 publicly insured children in that database, only 6.1 had an FASD code documented. Mm-hmm. And so we know that not every child with an FASD has an FASD-related diagnosis code recorded, but because those results are so much lower than those 1% to 5% estimates that I mentioned earlier, these findings really underscore the problems related to underdiagnosis and some of the work that needs to be done. Mm-hmm. I'll also say that we've been working closely with federal partners to include questions about FASDs on large public health surveys, specifically the National Survey of Children's Health. And the National Survey of Children's Health is one of the nation's largest surveys that collects data on multiple intersecting aspects of children's lives. In 2022, questions were added that asked caregivers whether their child was ever diagnosed with an FASD. And this information from the survey will provide the first national data on children with diagnosed FASDs.
What is NCBDDD doing to improve surveillance for children with FASDs?
So public health surveillance is the foundation of so many activities our colleagues and partners work on because it provides us with information about how frequently conditions are occurring and because it can provide insight into gaps and other clues to inform critical action. To improve public health surveillance of children with FASDs, we're working with academic, clinical, and public health partners on a project to better understand existing healthcare data as it relates to FASDs. This project, called Informing FASD Surveillance, or IFASD, has two main components. The first is the data component, which will help us understand what type of existing healthcare records might be important to leverage for future public health surveillance activities. This will also provide some insight into data quality. That is, it can help us understand how well different pieces of information are documented in those records. Getting a better understanding of those data can also help us understand some of the challenges related to diagnosing FASDs, such as if there's not enough information about prenatal alcohol exposure documented or recorded in different types of records. And then we have a second component that's aimed at better understanding pathways through care. That is how children and families navigated the referral, evaluation, and diagnosis process. And this information will help us understand the ways that children interact with healthcare or other social systems so we can understand where certain types of data might be available for public health surveillance. But it will also shed important light on the barriers and facilitators to receiving an FASD diagnosis.
Let's talk more about how this information is getting out to those who need to know it, or informing the health on public action. How is the NCBDDD working with healthcare providers to address alcohol and other substance use during pregnancy, specifically FASDs?
Yes, thanks, Chris. Our center has always recognized the crucial role that healthcare professionals play in the prevention, identification, and management of FASDs, which is why they've been a primary audience of our efforts for over 20 years now. Currently, our primary strategy for reaching healthcare professionals is through our FASD National Partner Network, which we call the NPN. And this is a group of 9 projects that started working together in the fall of 2022. And the NPN focuses on 4 main areas to support healthcare professionals. The first is to expand and integrate an FASD champions network. By this, we mean that we aim to build a strong network of professionals who are passionate about FASDs. The second is to coordinate and disseminate evidence-based and consistent messaging about this important public health issue. The next is using innovative methods to educate organizations' members serving populations of reproductive age, including pregnant people and those serving children and families. And then building capacity to link clinical and public health partners to reach affected populations with effective programs and practices. The audience for these activities are the members of the organization. So we know that providers trust resources and information from their professional societies. So messaging and resources from the organizations themselves will enhance trust and buy-in from members.
Can you tell us more about who is involved with the NPN network?
Sure. We have 3 components to this work. First, organizations comprised of healthcare and or allied health professionals serving people who are pregnant or might be pregnant and or children and families with FASDs. This includes the American Academy of Family Physicians, known as AAFP, the American Academy of Pediatrics, or AAP, the American College of Obstetricians and Gynecologists, or ACOG. And then we have university partners working with multiple organizations. We have the University of Alaska Anchorage, who partners with 2 national nursing organizations, the Association of Women's Health, Obstetric and Neonatal Nurses, or AWON, and the National Association of Nurse Practitioners in Women's Health, or NPWH. The University of Nevada, Reno is partnering with the American Association of Medical Assistants, or AAMA, and the University of Texas at Austin partners with the National Association of Social Workers, or NASW. Next, we have organizations comprised of non-clinical professionals who serve maternal and child health populations with more limited access to health care. So here we're working with Montana State University, who's partnering with the National Association of County and City Health Officials, or NACHO. And then we have organizations that engage with individuals, families, and communities affected by prenatal alcohol and other substance use, and or individuals with FASDs. And for this component, we're working with FASD United, formerly known as the National Organization on Fetal Alcohol Syndrome, or NOFAS, and Oak Ridge Associated Universities, or ORAU.
Can you tell us how these partner organizations have worked together to address prenatal substance exposure or support families affected by FASDs?
Yes, these projects have already developed dozens of resources for healthcare providers on the topic of alcohol and other substance use during pregnancies and FASDs. So this is things like practice manuals, online courses, journal articles, organizational policies and recommendations, grand round presentations, toolkits, webinars, blogs, and most recently, 12 new videos featuring people with lived experience of FASDs. These resources can help improve knowledge among healthcare professionals and ensure they have the tools they need to counsel patients and to help ensure that families receive the care and support that they need.
Can you talk a little bit more about some examples of the resources the network has developed?
Sure. For example, our partners at the American Academy of Pediatrics, or AAP, even way before their current work with the National Partner Network, developed a comprehensive web-based FASD toolkit. And this toolkit has resources for pediatricians to raise awareness, promote developmental surveillance and screening, and ensure that all children living with FASDs and their families receive appropriate and timely care. Additionally, AAP has resources to help pediatricians and other healthcare providers incorporate screening, brief intervention, and referral to treatment into their practices to reduce, delay, prevent, or stop adolescent substance use. Then the American Academy of Family Physicians, or AAFP, provides resources to help physicians recognize and address excessive alcohol use. They have a practice manual on alcohol and other substance use, and they also have an activity that offers continuing medical education credits around addressing prenatal alcohol and other substance use. Another example is the University of Nevada, Reno, in collaboration with the American Association of Medical Assistants, or AAMA, has developed resources to help maximize the limited time that medical assistants have with patients during appointments. And this includes a series of what they call walk and talk products for medical assistants to provide important reminders about alcohol and other substance use. The University of Alaska Anchorage collaborated with AWAN and NPWH to create a curriculum to support women's health, nurse practitioner, and midwifery education faculty to incorporate FASD-related content into their courses. And this team also has a series of short videos on a variety of topics related to FASDs, alcohol screening and brief intervention, and preventing alcohol use during pregnancy. Another example is the University of Texas at Austin, partnering with the National Association of Social Workers, or NASW, and the NASW Foundation to reach social workers at both national and state levels in the prevention of alcohol and other substance use during pregnancy and FASDs. They have a series of blogs and other materials to help social workers really understand their unique role in making alcohol screening and brief intervention part of routine care. And then our colleagues at the American College of Obstetricians and Gynecologists, or ACOG, have a free online learning module that helps healthcare professionals consider legal issues and ethical principles used in FASD prevention efforts. And this module offers continuing medical education and maintenance of certification credits.
How can we work together as a field to reduce stigma and help people that are pregnant and their families living with FASDs receive the support and care that they need?
Our FASD National Partner Network is working on a variety of efforts to address stigma. As an example, I mentioned our FASD Champions Network, and a really successful collaboration over the years, even before the NPN, is between ACOG and FASD United, where our OBGYN physician champions pair up with a speaker with living experience of alcohol use during pregnancy to co-present at grand rounds around the country. And we know that hearing from someone with lived experience is really impactful to these audiences, and it can help healthcare providers understand the need to be non-judgmental and create a safe space for open dialogue with their patients. Another example is that recently our partners at the University of Nevada, Reno, and University of Texas at Austin collaborated on a poster called Words Matter, and this has tips to reduce bias and improve communication to help promote alcohol-free pregnancies. Our partners at Montana State University worked with NACHO to develop a messaging guide for local health departments to help ensure consistent and stigma-free messaging when talking about the topics of promoting substance-free pregnancies and living with FASDs. I also mentioned that we recently developed a series of videos featuring individuals with living experience of FASDs. This was a really great collaboration between ORAU and FASD United. The videos feature 11 individuals and families sharing their stories about what it's like to be living with FASDs. They also share experiences and tips about diagnosis, support, stigma, and resilience. And in the next episode of this podcast, you'll get to hear from one of our video participants and learn more about her story. And you'll get to hear more about FASD United's work in general. And they are doing amazing work in the area of reducing stigma. As just one example, they recently released a language and stigma guide. This was part of a different partnership, but the guide is meant for the FASD community at large and provides a deeper understanding of how language affects stigma. And then we also have a whole suite of what we call Let's talk materials that came out last year. We worked with Oak Ridge Associated Universities, or ORAU, to assess healthcare professional and patient attitudes about alcohol use during pregnancy and to examine messaging and approaches to encourage conversations about alcohol use during pregnancy and alcohol screening and brief intervention. And then those findings were able to be used to create a communication guide for partners and a suite of materials for both healthcare professionals and their patients. So this includes fact sheets, badge cards, infographics, videos, and more. And we know that alcohol screening and brief intervention is effective and that it's recommended for all adults being seen in primary healthcare settings, but we also know that it's very underutilized. So the more we can promote asking all patients or clients about their alcohol use in an effective way and intervening as appropriately, then the more we can make this non-stigmatizing and a routine part of care for all adults.
Absolutely.
So these are just some examples, but they show that working with our partners to develop resources, and that by using consistent and non-stigmatizing language ourselves, then we can help address this issue within the topic of alcohol and other substance use in pregnancy.
Absolutely. Are there ways that the public health surveillance mentioned earlier might reduce stigma or ensure that people are getting the support they need?
Yeah, so I'll add that some of our data-related activities can certainly help address stigma and help pregnant people and families receive the support that they need. So first, information about the rates of alcohol and other substance use during pregnancy and the prevalence of children with a diagnosed FASD can be used to inform how much and what types of resources might be needed to support pregnant people and families caring for someone with an FASD. Furthermore, we try to widely share our public health surveillance reports and data. And by sharing that information about alcohol and other substance use during pregnancy and about the prevalence of children diagnosed with an FASD to different partners and organizations, we help to raise awareness and emphasize the importance of addressing and providing support to these populations. And then finally, that project I mentioned aimed at informing future FASD surveillance has a component to better understand and describe pathways through care. And through that work, we hope to identify facilitators and barriers to receiving an evaluation or a diagnosis for an FASD, which can inform future work aimed at reducing those roadblocks and therefore ensuring children suspected of having FASDs receive the evaluation and diagnostic services that they need, and that families with FASDs ultimately receive the support that they need.
Excellent. Thank you both so much. Nick, before I let you go, is there a final thought you'd like to leave our audience with?
Sure. So I'd just like to mention that for our public health surveillance activities, our center has been working very hard to enhance our efforts to measure rates of alcohol and other substance use during pregnancy and to understand the prevalence of children with an FASD diagnosis. And as I mentioned, public health surveillance data is really the foundation for so many of those other activities that have been mentioned and discussed. And so it's really important for us to get the best data we can so our colleagues and other partners can use that information to continue their important work, really to ensure that children with FASDs and their families receive the support and care that they need.
Absolutely. Elizabeth, is there a final thought that you would like to leave our audience with?
I hope listeners will have a chance to check out the resources that are provided with this episode. You can learn more about our center and the work we're doing around this important topic. There are also resources from the FASD National Partner Network that I talked about today, and also the Let's Talk materials to encourage conversations between healthcare professionals and their patients about this topic. And then definitely be sure to check out our new video series where you can hear from individuals with lived experience of FASD.
Excellent. And links to all of the resources mentioned will be available in the show notes for this episode. Nicholas and Elizabeth, thank you so much for being with us today and for doing this important work and coming to talk about it and help All of us have a better understanding of how important this is and our role. We appreciate you being here. Hopefully by now you've been able to think about and answer the question that we posed at the beginning of the episode, namely how researchers at the CDC work to measure the rates of alcohol and other substance use during pregnancy. And this is not the end of our special series on FASDs. On our next episode, episode 83, part 3 of this special series on FASDs, we're going to delve more into those personal life experiences and hear from those who are directly impacted by FASDs. Be sure to hit that subscribe button so that way you never miss a new episode, and you can go back and listen or re-listen to some of those older episodes as well. You can find us on iTunes, Spotify, Audible, or however you like to listen to podcasts. And if you want to be on the podcast or if you have an idea for the show, we would love to hear from you. Please feel free to email us at contact@mothertobaby.org. And MotherToBaby is here to answer your questions about exposures before and during pregnancy, while breastfeeding, or if you have questions about exposures and adoption. You can reach us by phone at 866-626-6847, by text at 855-999-3525. You can visit us on our website, MotherToBaby.org, and there you can chat with an information specialist. You can look at our many blogs, information pages, our hundreds of fact sheets that are available free in English and in Spanish. And you can also listen to our podcast or find out how you can participate in our pregnancy studies. If you would like to support the Mother to Baby podcast, as well as all of the ways we get critical pregnancy and breastfeeding health information to you at home, we have a new way to do just that. Encircle is our new monthly giving society that helps ensure we can continue to provide our services at no cost. Join the community today and encircle parents and babies in health. Members will be recognized on the podcast and website. Visit mothertobaby.org/donate today. Until next time, remember, Mother to Baby is here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.